Luma, Care Together, presented by Scream Team, Mira, Arushi, Sheila, and Cullen. In the United States, about 300,000 children and adolescents have diagnosed type 1 diabetes, and 30% of parents report distress when their kids diagnosed with the disease. Our persona, Vivian Chu, is one of them. She is a stay-at-home mom who is a caregiver of 3 family members with type 1 diabetes. One of them is her daughter, 8-year-old Rose, who is almost fully dependent on her. We identified their challenges in 2 levels. Individual levels include sleep disrupt, low mental well-being, and technology fatigue. Family levels include limit budget and restrict in place. We hypothesize that if data can be presented in a clean, calm, flexible, and effective way, then diabetes care can be less overwhelming for caregivers, more fun for children, and more informative for healthcare providers. Our methods start with building empathy, followed by research and interviews to iterate our design. We use 3 approaches to build our empathy: LilyPad, empathy mapping, and interviews. This approach helps us to feel and identify individuals and family level challenges we shared earlier. In the second phase, we conduct tech and literature review to make sure our design is evidence-based and updated. After all the research and interviews in digital aspect, medical information, nutrition, telehealth supports, and self-care are useful information to be included. For the physical aspect, we identify some features, size and numbers, and locations of the screens, which we will share in a minute.
Building on our research and takeaways, we propose a design solution in the form of a digital app interface called Luma, accessed through new and existing screens in the Miller family home. Structuring our design in a progressing timeline, in the now phase, we propose to incorporate Luma to bring ease and efficiency to data visualization and info integration. In the near phase, Luma supports bridging the clinical healthcare system and the home. In the far phase, Luma enables the home to become the care agent. Luma is designed to have profiles for the caregiver, Vivian, patients Austin and David, and child patient Rose. The framework enables Vivian to access the family's data and self-care resources for herself while making her family gain more independence. We reviewed the scenarios provided for the Miller family to map out a day in the household along with the VR experience to help situate the activities. Based on the information, we marked moments of alerts and checks, moments of medicine administration, and interactions with Vivian. Using this, we created a timeline to show how Luma can be applied to an evening in their home, from supporting dinner time at 6 p.m. to bedtime at 10 p.m. and even in the middle of the night in case of hypoglycemic episode emergencies. Luma supports Vivian and her family.
Taking a closer look at 6 p.m., Luma supports Vivian in dinner preparation by displaying carbs and proteins counts on the mounted iPad. It also gently reminds her to administer Rose's insulin through soft music. After dinner, Vivian prepares for a telehealth visit without juggling paperwork. Luma organizes everything on the TV screen while Rose uses the iPad to prepare a snack package. At 9 p.m., Vivian can quickly glance on everyone's CGM data. Luma shows trends clearly and only alerts when needed. Before going to bed, Luma sends gentle reminders for David's medication and keeps Vivian informed. It also prompts her to take care of herself with yoga to reduce her mental load. During nighttime, Luma creates a safe, low-light environment if someone wakes up. Vivian can check on David without turning on bright lights or fully wakening herself. Throughout the night, Luma uses the smartphone and the refurbished iPad to support Vivian by regulating circadian rhythms and reducing alert fatigue. Soft, warm ambient light and gentle music alerts stand out without startling her.
Distributing care functions across different screens in the home will ultimately reduce tech fatigue while fostering independence for Vivian's family and streamlining diabetes care in the home. As Luma evolves in the near future, we anticipate integrating a care provider profile in Luma, creating a seamless flow of information between the Miller family and their doctors. In the far future, we project that smart home technology may have much wider capabilities, allowing Luma to transform the whole home into a smart care provider that knows all the family members and activates when needed to provide alerts and valuable information. Overall, through screen interventions that tailor data display and interaction to various user needs, Luma provides personalized support that helps Vivian's family members become empowered to manage their own illness and care for each other. This allows Vivian to step back into a passive role, monitoring for emergencies and freeing up much of her cognitive load. Ultimately, through a balanced and flexible approach to data visualization, Luma fosters independence for diabetes patients and relieves caregiver burden, transforming diabetes care into an easy and streamlined part of life in and out of the home.